Hello and welcome to Allied Health Educare. Allied Health Educare is providing you a good quality of teaching. Allied Health Educare representing some new videos about some special technique regarding microbiology subject. So today we are demonstrating the Nocardia bacteria, how to process, how to stain, and how to demonstrate under microscope whether it is Nocardia. So we have recently found Nocardia in a sputum sample. We have inoculated this sputum sample to Pseudodextrose agar. In Pseudodextrose agar, the white rough colony appears. This is the colony of Nocardia. So this Nocardia is a weakly gram positive. It is a weakly gram positive bacteria, or the bacteria cannot be properly stained with gram stain. But it is a weakly acid fast. For the demonstration purpose under microscope, we have to stain the bacteria, or we have to stain the smear of the bacteria that is made from this type of colony. Can be demonstrated by modified acid fast staining or modified Jehelnitsen staining. So in modified Jehelnitsen staining, to demonstrate the Nocardia bacteria, we have to use 1% H2SO4. Other staining remain same, that is carbolfuchsin remains same, methylene blue, that is counter stain, it remains same, but we have to use 1% H2SO4 for the decoloration purpose, as it is weakly acid fast. If we stain with 20% H2SO4 or decolorize with 20% H2SO4, then the carbolfuchsin may be washed out. So today I am going to demonstrate how to make smear of Nocardia. First of all, this type of colony is very difficult to emulsify. This is the white type colony, white or maybe pigmentation produced, and it is a very important for the demonstration purpose. There are various species of Nocardia. Maximum are pathogenic bacteria, or some are non-pathogenic bacteria. So here you can see the colony, this colony of Nocardia asteroides. Nocardia asteroides, it is it is grown in the Pseudodextrose agar. So most commonly encountered species are Nocardia barcellensis. Barcellensis is a most common bacteria, and the pathogenicity of bacteria, it may infect our lung, it may causes fever, and it is obviously is a opportunistic bacteria. It can affect the immunocompromised person, like HIV positive person, which have the person suffering from HIV may get Nocardia infection. The most common form of human Nocardia disease is slowly progressive pneumonia. The common symptom of which include it may be cough, shortness of breath, and fever. So here, first of all, we have to look into it the characteristics of colony. Nocardia colony on the culture media, it is dry. You may see this colony is dry, powdery, and sometimes filamentous, but in this case the filamentous appears does not appear here, and they can be white on various shades of yellow, orange, pink, red due to the production of pigmentation. It may produce different type of pigment. So first of all, for the preparation of smear, we have to take a slide, then put 1 drop normal saline here, just like preparation of any other colony smear preparation. Just open the media, open the cotton cap, and try to obtain the colony. It is very difficult. I am trying my best to obtain colony from the SD agar, and little colony will come off, and emulsification is very difficult, so it is very much cumbersome and laborious process to make a smear of Nocardia. And you have to emulsify the colony. It is very difficult to emulsify the colony, as the colony is dry and rough also. So I am trying to make a homogeneous emulsification of the colony. The smear is made, and keep it for 5 minutes and let it dry. As you can see that the smear is prepared by using normal saline. Earlier I have told you that it is very difficult to emulsify the colony, as the colony is very dry and very hard. So now, after making smear, it is heat fixed. Heat fixation is required so that the smear is not washed out during the staining process, modified resin staining process. So after making smear by using normal saline, we have to heat fix it. So now we have to stain it by modified resin stain. Modified resin stain is nothing but resin stain mean we have to use carbulfuchsin, unheated carbulfuchsin. We have to use unheated carbulfuchsin. We need not in modified resin staining we need not heat the carbulfuchsin. So just pour the carbulfuchsin on the slide and let it for 8 to 10 minutes. Then wash the stain, pour the stain and wash the stain. After washing, decolorize it by using 1% H2SO4 and 1% H2SO4. After the 1% H2SO4 decolorization process, add contrast stain methylene blue and keep it for 1 minute and wash the slide with tap water, and finally focus the slide under the microscope at 100x power. So finally staining process is over. Previously I have shown you that 3 slides are made. One is directly from the sputum sample and another two slides are made from the colony. So the slide made from the colony, one of the slide is stained by gram stain. As we see that the bacteria are quickly gram positive. The bacteria appears as pink. Bacteria appears as pink, and it is the Nocardia species, and it is filamentous in structure. Filamentous. Some filament is long and some filament is short. So this sample, this here is made from the colony itself. Now move to the second slide. This is the modified resin stain that is applied, and that is the slide is stained by the modified resin stain, and this slide is made from the sample itself. This is the sputum sample, and this slide is made. A smear is made. A smear is made from the sputum sample, and sputum is subjected to modified resin stain. Here we use 1% H2SO4 instead of
20% H2SO4 as a decolorizing agent. Why should we use 1% H2SO4? Because this bacteria is weakly acid fast. If you use if we use 20% 20% H2SO4, then decolorized it get decolorized, and all the carboxyl that is taken up by the bacteria is all washed out. That is why we should use 1% H2SO4 instead of 20% H2SO4. And you may see in the slide that there is a filamentous structure. Filamentous. This is the most important point regarding Nocardia. There are lots of filamentous structure. This just like that. It is a filamentous structure. It may be confused with the hyperstructure or mold structure of the fungus, but you have to remember it is not at all fungus element or fungal element. There is a similarity between Nocardia and fungal hyperstructure, but in case of Nocardia, it is evident that it is a filamental structure. Instead, it is a bacteria. Now move to the third slide. This filamental structure, it is very prominent over here. It is very prominent, and this slide is made from the colony. And colony, after smear is made from the directly from the colony by normal saline, which I have already shown you, and it is subjected to modified resin staining. After the slide is stained, the bacteria look like filament. Here, the filamental structure is more prominent than the slide is made from the directly from the sample. So here you can see that all filamental structure, and this filamental structure represent nocardia. So it should not be confused with any fungal hyphae or fungal molds. So this is how we can demonstrate the Nocardia species. Nocardia species is very rare. In routine laboratory procedure, we do not found any type of Nocardia species, but sometimes we encounter this type of species. So I have encountered this type of species few days back in a sputum sample. The sample is taken from a patient. The patient is suffering from HIV, that is immunocompromised patient. Those patients have immunocompromised patient. Those patients have immunocompromised, or those patients have weakened immune system due to the different condition. They may get this type of infection. So this is how we can identify the Nocardia species. Thank you. Stay tuned to our channel. Like, share, and subscribe with your friends. And please support us so that I can provide you this type of video in future. Thank you.